Well, in simple terms, the idea is that we all work together nicely and we organise all of our services seamlessly around the needs of the individual person or their family or their community. Now, that's very easy to say. Lots of people imagine that we do that already, but actually it's very hard to achieve.
So I think all of the different players within the local health and social care community working together is really important for patients, and that's why it's really important for me. I work in a hospital, so for me, integrated care is really about helping to support people to stay out of hospital, if we can, but when they do need our care, that they stay with us only for that period of time where they really need us, so that they can move to their own home as quickly as possible. Because what people don't realise is an extended stay in hospital isn't really a good thing for patients. The longer you stay in hospital, particularly if you're frail and elderly, the less likely you are to return to your own home. So if we can get everything working together, so that when people are ready to leave hospital, that all of the right services and support are available for them, then that's good for patients.
We're working very closely with all health organisations, the voluntary sector and other organisations to come together to provide what we hope will be a better service for people.
But because of the system is set up in the way it's set up, people often get cared for in the wrong setting or not in a joined up fashion. So there's a real opportunity here to keep people closer to home.
Derbyshire Community Health Service staff sit alongside my staff in the social work department at the Royal, so they can iron out any problems between themselves. And we also have social workers working very closely with clusters of other staff around GP surgeries, so that we think not only about people's healthcare needs but people's social and healthcare needs, to provide them an emotional and social care package, practical support for people at home, equipment that people might need to be able to get them home or to keep them at home so they don't have to go into hospital, to try to prevent people going in, staying in hospital a shorter period of time and getting out as quickly as is appropriate for them and their carers.
Most of our GPs are very aware that there are a plethora of really good voluntary sector services out there, but they don't know where to find them or how to get hold of them. So we funded a pilot with North Derbyshire Voluntary Action, where there's a single number now that you ring if you've got a patient, a client who needs something, and they will sort it and put them in touch with the relevant organisations. And actually the scheme won an award last week, which is really great. So
we've got some great examples where teams are coming together across health and social care to do the right things for people, to treat them in a joined up way. What we need to do is do that at scale, but actually let's hear from some of the people who've benefited from this, the real people on the ground, the patients, the people.
Community support teams are really making a difference to patients because they feel now they can sort of speak to one person regarding everything, and because we have these meetings where we can discuss across the board with different agencies, we've got a continuity of care.
Community support teams are making a difference to patients and the family simply because we're supporting patients to be looked after in their own home. All the care that they need should happen in the home and is available. We just need to communicate that from the patient to the teams that's available.
In my opinion, community support teams make a difference to patients by them only having to share the information with one of the team members, because we're actually all working together, we meet regularly, we talk at the community support teams meetings we have. And I think that's important. They don't see us as different anymore. They see us as working with them as one service rather than separate social care colleagues and health colleagues.